What is my QL?
Your QL. So your QL comes from basically your spine down to the crest of your ilium, so, or your hip bone, just to make it easier. If you were to look on here, there we go. So it looks, basically kind of sits like this. So it's like a angled up, and then you have one on each side, right? And the thing is, when we sit a lot, that muscle just gets really, really short. And because of that, once this gets really locked up, I guess the typical compensation is, all right, so if this is locked up, then it's going to cause everything above and below it to strain more because there's not mobility here, so we have to move too much here. And so what happens is a lot of people, especially people who do a lot of like desk work or whatever that might be, they end up getting a lot of pain here, but it's not because the muscles are causing the pain here, so to speak. It's actually a secondary issue to where the tightness is here. So when you're thinking about treatment and stuff, you gotta, or movement or stretches, you gotta figure out a way, okay, well, it hurts here, how about I work on the areas above and below it to see if this resolves? Because a lot of times what people end up doing is they end up working on here and it feels kind of okay, like not all the way good, but then it gets worse and gets worse because this is never addressed, and then this is already taking the tension already from the strain that you're putting on it, and then adding more hands-on to it might make it worse. So the QL is pretty important from a posture standpoint. Really compresses the spine, so having flexibility here in the low back area really helps reduce more of that chronic pain, both in the low back and the upper back area.
Mm-hmm. Mine always seems to aggravate from lifting heavy the next day, then like it's right above the pelvis or the hip, I guess. Yeah. I get those knots. You dug your thumb right, like barely above somewhere. It was just like.
What a lot of people don't realize is that even with GI issues or stomach issues, whether it's constipation, IBS related is a big one, but when that muscle's tight because of the nerves that actually come out from it, if this is compressed, it alters the way this nerve works. And so that can actually be the cause of issues in your stomach. So not only does it help with pain, but even like actual organ function within this vicinity of where the QL sits in the lower thoracic and upper lumbar area. But yeah, I mean, it can affect you if one side is, and the worst is actually when one side is tighter than the other and you get kind of this little kind of side tipping. So when you lift stuff, when you start to lift and you're already kind of sideways, you end up kind of spasming. That's when people are like, oh, well, I hurt my back, and it hurts on like kind of that thumb point in the back because you were kind of twisted and then you lifted something with pressure and it caused almost like a rotary or just an asymmetrical contraction, and it caused that spasm. That spasm is there to really protect your joint. So now, again, you have this nagging pain that could last for a week or even like 3 to 4 months. So that muscle is really big when you think about stability, mobility, like just being able to do functional things like get your laundry basket and lift it up, tie your shoes, like just going into that downward motion and coming back up. If that's locked, a lot of times it'll just kind of twinge on you. Now, there's other muscles that are involved in that, but this is kind of more so the precursor, the one that typically starts to get tight before all the other ones get tight. So I think that having an understanding what the QL does and where the QL is and how to address it with both stretching and exercise will overall increase the stability and also the organs functioning around it. It's pretty interesting how it works.